I'm a carnivore doctor talking about beets. Why? Because my patients are already using them. Many are not carnivore, and they count on me to be the source of truth. Even when the truth is purple and stains your cutting board, I'll always cover what people actually do in the real world, then bring it back to root cause. Here's the framing. The root cause of vascular disease is rarely a beet deficiency. It's insulin resistance, chronic sympathetic drive, ultra-processed carbs, poor sleep, and environmental stressors. You don't fix a house fire by spraying a plant-based antidote on the smoke. You remove the fuel and cool the flame. That said, until you've healed with low-carb, keto, or even my favorite, carnivore, certain tools can nudge blood pressure and endothelial function in the right direction. Beets are one of those tools, not the fix, a supportive adjunct. Mechanism in one breath. Beets lead to your oral bacteria reducing it to nitrite, leading to your tissues converting it to nitric oxide, leading to vessels relaxing, leading to your blood flow improving, and ultimately your blood pressure drops. Here's a lesser known nugget. If you carpet bomb your mouth with antiseptic mouthwash, you blunt your conversion of nitrate to nitrite, and the blood pressure benefits fade. So protect your mouth bugs that help your arteries by avoiding mouthwash if you are relying on beets for your blood pressure. So which form is best? This is the question that inspired this video. Whole beets, concentrated juice shots, or powders and capsules? I'll be honest, I was hoping capsules or powders would win because juice has carbs. My low carb crowd doesn't want a sugar side quest with their nitric oxide. But when we follow the data, standardized beetroot juice shots still have the most consistent blood pressure reductions in hypertensive adults. Typically, single-digit systolic drops that are clinically meaningful when stacked on lifestyle. And dose matters. Studies that clearly deliver a few hundred milligrams of nitrate per day show the most reliable effect. But the carbs are real. A typical 70 milliliter concentrated shot lands roughly in the 10 to 15 grams of carbohydrate range per bottle, depending on brand and batch. For example, manufacturer nutrition panels list 17-gram carbs per 100 milliliter. That's approximately 12 grams per 70 milliliter, while consumer databases report 14 to 15 grams per 70 milliliter. A standard glass of beet juice, approximately 240 to 250 milliliters, is 20 to 24 grams of carbs. You can use it strategically, but let's be honest about the payload. What about capsules and powders? This is where the story has gotten better. For years, many beet products didn't even tell you the nitrate content. Pretty label, uncertain chemistry. That's changing. We now have randomized trials of nitrate standardized beetroot extract in older postmenopausal women showing improvements in microvascular function over 7 to 12 weeks. That's upstream biology we care about, and it comes without the sugar hit. Caveat: sample sizes are still small, so expect more research. Whole beets are real food, and you know we prefer real food on this channel with potassium, pigments, and flavor. But nitrate content varies by soil, season, and storage, and boiling can leach nitrates. Great on a plate, less reliable as a precision dose. If you love them, roast or steam and enjoy. Just don't expect clinical repeatability unless you juice or standardize. And yes, red urine or stool is usually harmless. Your kidneys aren't crying. Your beets are just loud. Now, the common sense part, especially for my insulin-resistant folks. Hypertension and insulin resistance travel together so often that clinically, I treat most people with high blood pressure as insulin-resistant until proven otherwise. Mechanistically and epidemiologically, the link is strong. That means we balance the science with practical judgment. If your insulin is driving vascular stiffness, don't tolerate the sugar found in beets to chase nitric oxide. Prioritize low insulin living first, then layer in nitrate only if needed. Here's a simple root cause first protocol you can copy. Start with the big rocks. Lower insulin exposure. Ditch ultra processed carbs. Anchor meals in protein and healthy fats. Walk daily. Manage stress. Sleep like it matters. And keep sodium, potassium reasonable. not extreme. When those are in play and you want additional support, consider a 14 to 28 day nitrate trial and measure. Pick one form and be consistent. If you're not very carb sensitive and want the most studied option for blood pressure, use a nitrate standardized 70 milliliter beetroot shot daily that declares its nitrate content, approximately 300 to 500 milligrams. Take it with a protein-rich meal if you want to blunt glycemic impact. If you are insulin resistant or simply carb conservative, choose a nitrate standardized capsule or extract that delivers a similar nitrate dose, roughly 300 to 600 milligrams a day depending on the product. So you get the endothelial benefits without the sugar. My hope going in was that capsules or powders would beat juice on outcomes. What we actually see is this. Juice has the most blood pressure data, while capsules show promising vascular function data with far less carbohydrate. That's a fair trade many of my patients prefer. Protect the pathway, avoid antiseptic mouthwash during the trial so your oral microbiome can run the nitrate-nitrite relay. Brush, floss, tongue scrape, yes. Antiseptic mouthwash, no. Measure what matters. Check seated home blood pressure in the morning and evening after 5 minutes of rest. Look for systolic change first. If you're on antihypertensives, watch for lightheadedness and talk to your clinician if numbers trend down. You may need adjustments. I also want you to mind the edge cases. If you form calcium oxalate stones or have advanced CKD, in that case, avoid mega dosages of beet products and consider the capsule route under guidance. And don't let red urine freak you out after a beet day, where I net out for vascular health and blood pressure control. Here's my take. If you're metabolically healthy and want the most evidence-based blood pressure nudge, a standardized 70 milliliter beet shot can help. If you're insulin resistant, which practically speaking includes most people with hypertension and diabetes, favor a nitrate standardized capsule or extract to capture nitric oxide biology without stacking carbs on top of insulin resistance. Then keep doing the things that actually reverse the disease process. Lower insulin, reduce sympathetic overdrive, sleep, move, de-stress. Beets will polish, the fundamentals rebuild. Put differently, use science, then use your common sense. Beets can widen the road, but removing the traffic jam, insulin resistance, gets you where you're going. When you combine both, arteries relax, numbers improve, but never forget, you don't have to trade metabolic health for nitric oxide. Let your overall diet be the best medicine, not trying to add that one magical food that's supposed to fix everything. That's food as medicine, not food as marketing. I'll see you in the next video.